Well, hi, everybody. So we are My Doc and Dukov. We just got our promo out there. Everybody can hear it now.
Sounds great.
It does. I'm excited. It's Alicia Dukov, so I'm sure they'll be fixing that. But Dr. Jenkins still gets my name wrong after 25 years, so hey, what do you know? And today we have a special guest. Dr. Jenkins, why don't you introduce?
Well, I've been working with some recovery centers in town here, and the Valley Recovery Center is in downtown Newhall, just south of the boulevard, south of Lyons Avenue, I should say. Mm-hmm. And we have Art Moduleski here. I think I almost said that.
That was close, yeah.
I almost said it right.
Okay, you're another one, right?
Almost there. But I mean, I couldn't pronounce my last name until I was 5.
Oh, so okay. We're going to give you a break. So say it slower. Art
Mogilewski.
Is that Polish?
It is Polish, yes.
Cool.
But
Okay.
he grew up in the Ukraine.
Yeah.
Awesome.
Well, I grew up here, but my family, originally from Ukraine.
My mom's side of the family is, her mother was Polish. It's Brokowski.
Oh.
So that's why I knew that.
S-K-I? Or?
Who the heck knows? Yeah.
All right.
It's hard enough to say Alicia versus Alicia. So, you know.
Right.
But
Welcome.
Art has the Valley Recovery Center in like I said, off of Valley Street, and it's just a wonderful facility. I've been there a couple of times for meetings and to meet with clients, and it's beautiful there. The food looks good. The backyard's beautiful. I want to move there.
Yeah, emphasis on the food. Definitely, the food is fantastic.
The food is great. That lady that cooks that food, she's a good.
Yeah, thanks to our chef Corey. Absolutely, yeah, she's amazing.
But Art, tell us about yourself and about your center and how we can send people to you if you need to.
Of course. Well, first of all, I'd like to thank you both for having me on the show. This is fantastic. So a little bit about myself. Well, my background is in healthcare. I've been in healthcare for over 12 years now, primarily in geriatrics. But what drew me to the addiction industry is the passion I have in helping those people in need. And unfortunately, we're in an age where there's an epidemic. There's a huge epidemic with opiates. Of course, there's always been a problem with alcohol abuse, and we saw an opportunity to be able to help, especially the community of Santa Clarita. And
is there a big need here?
Absolutely. There's a huge need. And the biggest problem, unfortunately, is the education behind how to get help. And what is treatment? What does it look like? Who is it available to? What is covered, through insurance or not?
A lot is not. Is what I have been reading. Insurance companies don't often take on recovery, like treatment, as part of what they will take on. I mean, it's really unfair because it's such a needed thing, and I think that's what you're talking about right now, is changing the culture's awareness of the fact that it's really a viable and maybe the most viable source of recovery for these people, treatment.
Absolutely.
Right,
Well, mental health, there's definitely a stigma behind it.
Yes.
There's definitely, it's
underfunded, undervalued,
exactly.
understood. It's not it's totally misunderstood.
Absolutely.
So yeah.
The one thing about substance abuse that most people need to understand, and this is the key, and the Surgeon General had in his report, that substance abuse is a disease. And like any other disease, there is treatment for it. And insurance does cover it. And you just need to know what type of insurance to have and to get. And also, the biggest issue is the education behind employers who are not educating their employees on benefits, which insurance policies are better than others. And that's something that is a goal of mine. And we were talking with Dr. Jenkins and probably educating and providing educational courses to the community on
that's great.
Which policies to get, which ones pay the most, which ones pay the better ones. So,
and the reason why that's not a current topic on the table, pushed as forward as you'd like it to be, is because of the idea that it's not really a thing that you take seriously.
Absolutely.
And that's what we want to change.
Yeah.
You and I, because we're kind of in a parallel sort of profession where I'm seeing them in a different kind of treatment. Mm-hmm. But a lot of addiction comes through my office. And it's not just substance abuse, it's every kind of addiction. Mm-hmm. We're going to talk about addiction today and what that is on a psychotherapeutic level. But you see them to treat them in a sister way, through like a more physiological and a more open perspective of like the whole person. You're looking at the entire person, right? You have an
absolutely. So if you like, I can kind of go over.
Yeah, let's talk about it. Tell me about your treatment center.
Yeah, so again, Valley Recovery Center, it is an all men's program, and Gender-specific programs are definitely needed in this industry, obviously, for both sides. Men feel sometimes more comfortable opening up in front of other men, and women, of course, as well, who also suffer from a lot of trauma and PTSD. So we designed a program for men. It's a maximum of 6 clients, so it's very small, it's intimate. Every client has their own private room. So everything is completely individualized, and you hit it, the nail with the hammer that addiction is not the same across all spectrums. Everybody
very
has
individualized.
Individualized. Everybody has a different trauma. Everybody has a different issue or problem that they're dealing with. And when you're dealing with treating the addiction, you're not treating the drug or the substance or what they use. Because if everyone was an addict in the same token, everybody would be using drugs.
And I think that's been the big problem. They've been treating up to this point, up to this philosophy that you're bringing up now about the individual, right? They've been treating people like a number through these recovery centers where they're treating the actual outcome of the trauma. They're not treating the reason why the person went to these substances to begin with. It's like cutting weeds in a garden. This is the metaphor I always use. When you're cutting weeds in a garden, what happens? The weeds grow back that much stronger. You're not killing the poison. You're not extracting the poison from the root that has caused the weeds in the first place. So you have to get under the ground. You have to get a little dirty. You have to get that work in there and really resolve where those weeds sprung from. Stop killing the weeds. Get to the root of the problem. Exactly. And that's what you're talking about.
The same thing happens when they relapse, is that they all have different reasons for relapsing, and they have to learn what the trigger is.
Trigger is a big word.
And if you're addicted, you may have a relapse. Most everybody has a relapse. And at Arts Valley Recovery Center, they work hard on that, and people are really improved by the time they get out.
Well, the key focus of, for instance, our program and the lack thereof of a lot of programs that is out there is the continuation of support and care. And that is why, let's say, for instance, AA and NA has had such great success, is because the purpose.
Network.
Such a network, a sponsor, someone to be there for you in a time of difficulty. And that's why our case managers, we follow our clients for the rest of their life. We call them every single month, and we make sure that, you're right, doctor. I mean, triggers come from a job loss.
Anything external.
Money.
I had one today. I got divorced, and this guy had been clean for 28 years. So this divorce hurt him so badly that he had to go back to using.
Right.
And you know what? These triggers are much more subtle also in the external environment. I mean, somebody can go into a supermarket and that's where they were raped, God forbid,
Absolutely.
And that is what back 20 years ago sent them down the rabbit hole of opiate addiction, because they were raped and they were trying to escape from the trauma in their body. Usually most of the time when we go through an addiction, when we even start something substance related, it's to release the pain. It's to get away from that pain. We can't get out of our bodies. We are stuck in here, guys. So if we can shut our minds down through some great drug, usually that's where it starts, because there's been some heavy trauma that has not been emotionally understood in the person or released in some healthier way. So 20 years back, that person had an opiate addiction. Maybe they've been on and off the wagon, in and out of recovery treatment centers, and they go into a supermarket one day. Maybe they'll see a person that reminds them of that person that raped them. Maybe they'll pick up the milk and the milk spills, but that reminds them of the day that the milk spilled and they got raped. I mean, those are the triggers that could send somebody right back where they started.
Well, triggers also, kind of to add to that, also have a dependence to profession, age. So we see with our younger population, our clients who are ages of 18 to 25, 30, for them it's a failure to launch. They don't know how to write a resume. They don't know how to job interview. They don't know how to stay in school properly or keep a proper education. I had a client that couldn't use a cell phone, didn't know how to use it, and was frustrated by it.
So it makes them anxious, and that anxiety triggers the need to fill it with something.
So, I mean, providing treatment and care. So, for instance, we have a life coach that comes in every week. We help them with resume building. We help them with, we'll do a couple of mock interviews with them.
Life skills, basically,
life
right?
skills, exactly. Yeah. And then you have the population like the first responders, the cops, the firefighters, the people that are there fighting for us to be safe. They have traumas that are completely different. So everybody, that's why, again, going back to it, everybody's different. Everybody has an individual need, and it's about addressing that individual need.
That's beautiful.
Well, one question I ask the clients that come in, I said, how do you sleep? And all of them say, I can't go to sleep at night. I can't turn my mind off. I can't, I use drugs sometimes. I just want to go unconscious and not be able to think about things. So I'm hoping that as the medicines for therapy for addiction to get better, that'll help them with that. And one thing that Art does at Valley Recovery Center is that he offers the patients long-acting medications that will help block the cravings for the drugs, cravings for the alcohol, and those are the injections you get once a month, or there's an injectable medicine that lasts for 6 months.
What's it called?
Bupinex.
Okay, so what does it do?
It locks up the receptors so you don't get buzzed from any drugs that you use.
Okay, so you could use a drug after having this shot, but it won't have the same effect.
It won't have the same effects. Yeah.
Right. It's a blocker, pretty much.
Yeah, it blocks up the receptors so that you can't get excited.
A dopamine blocker?
No, I don't think it's dopamine. No.
Because isn't that the pleasure receptor site?
Yeah, but it is. But this is an addiction center, so I don't know which blocker it is exactly.
Okay.
It's probably an opioid one, probably. But the thing about those things are so good because you don't have to worry about it. You're good for 6 months, and you just go on with your life and get better, and then see if you need another one after 6 months.
The thing to add to that, and I agree with you, and we offer that to all of our clients at the end of the program, but we've had clients who are on Vivitrol and they still relapse because Vivitrol, which is the shot, doesn't necessarily block everything. So there are certain things that still get through. So the key to it is to get that proper treatment and the proper support in conjunction with getting the shot. Right. Mm-hmm. So that's something to really understand how that works.
Right. I mean, look, you're gonna spray poison on the surface of the garden so that the weeds don't continue to grow back, but that's not getting inside, underneath the surface to where the issue arose in the first place.
At your office, at your house there, how many people are recovering that work there?
That are in recovery actively. So I would say that half of our employees are in recovery themselves of a minimum of at least 5 years. And we have most of our clinicians, so we have 3 therapists, 3 therapists specializing in different modalities, family therapy, trauma work, they're not in recovery, but they're looking at a perspective from a clinical perspective. And then we have substance abuse counselors who will, so we have about 6 individual sessions a week typically for our client, a mixture with our therapist, our counselor, and our psychiatrist. So the beauty of having both perspectives is that they're able to meet the client where they're at and they can address it from all different angles.
Oh yeah, you're combating it from every aspect.
Yes.
I mean, mind, body, spirit, really.
Right.
Now, a substance abuse counselor, for those that don't know the difference, what would be special about that substance abuse counselor on the panel for that person in conjunction with them seeing a therapist for cognitive behavioral therapy?
Right, exactly. Right. A DBT or CBT or there's a
DBT
EMDR,
for trauma and all of that. And then trauma-focused therapy is huge.
Exactly.
But we'll get into that. That's kind of my portion later. Yeah. So tell people why a substance abuse counselor is specific to this field and why it's important for somebody in recovery.
Absolutely. Right. So, and we have fantastic substance abuse counselors who have been in the industry helping people, have gone through their own struggles, but have been helping people for many years. Again, the beauty of it is to be able to meet the person at a ground level where they can relate to you and they can understand where you're coming from and they've been where you're at and they are a positive reflection of where you could be. And that's very important because, we always strive to look up to somebody and always push ourselves to be like someone that we admire, and to look at somebody who's went through it and is now clean 20 plus years. Right. It's like, I can be there too.
It's not just having a sponsor. It's almost like a clinical sponsor at that point. Exactly. Because substance abuse counselors, from the ones that I've known, first of all, you don't need your master's to do it. It's a bachelor's, and then you have to take a specialty course, a specialty training course for that particular strain.
Right.
And most of them that I've known have, as you said, had their own experience in treatment, have gone down the rabbit hole and made it through the other side alive, and can tell that story from a very deep, understanding, empathetic place that maybe a clinical psychologist or that psychiatrist would not have been able to, but we're combating it from the mind and a different place. That substance abuse counselor is like that sponsor, but from a training and a clinical perspective that the sponsor might not have in AA.
Exactly.
So yeah, it's a special deal.
Absolutely special deal. And we have some of the greatest ones at least in this area. So we love our counselors. Absolutely.
That's great. Okay, so now how long do people generally stay? You said that there's 7 spots? You don't take more than that, or?
Yeah, so there's six beds available. We are in the plans of expansion, but typically our program ranges from a 15 to 30 to 60 to 90 day program. Typically our 15-day programs is more of a stabilization for someone who just recently relapsed and really is
off the wagon.
Yeah, it just really doesn't need a full 30-day blown program. We have a 15-day stabilization. 30 days are our average length of stay. And for those people who think 30 days is a long time, it flies by in an
I want
instant.
to talk about this.
Yeah.
Okay, so if you're listening to this show or you know somebody who's currently in the throes of their addiction and has not gone to treatment yet, 30 days sounds like death, right? Because you're taking that drug away. It's like not even on their radar to even think about what that would feel like at this point. Because how do you function without that drug that is keeping you alive right now, so you think, right? Mm-hmm. So 30 days feels like forever.
Right.
Why would somebody come in for a 30-day? Like, why 30 and not 60 at that point? Explain the benefits of the difference between the 30-day, 60-day, and 90-day.
Right. So here, the Surgeon General report stated that in order to really get true recovery, be in true recovery, and really not, continuously run away from something, someone needs to be clean and sober for at least 5 years, right? 5 years is the benchmark. Now, there is no treatment program for 5 years, right? But, I wish I can run a program for 6 months or a year. It's very difficult, obviously, financially, but 90 days, it's a lot. I don't think that someone needs to, depending on the case, but 90 days, at least within our program, is super intensive. Now, most of our clients go through a 90-day program, but it's a combination of inpatient and outpatient. So they can continue as a step
living their lives.
Exactly. Living their lives, but continue. It's like going to see a therapist for a couple hours a day, and you can continue going to work.
Whereas 30, you're in. You're in for 30 days. And usually, what does that look like? What presents to you with that person that comes in straight off the street?
Right.
So 30 days.
In
a 30-day program. What
people need to understand is the first week or two, you're really, at that point, you're just detoxing, right? I mean, you're getting some therapy sessions, you're working with some of the clinicians, you're doing some groups, but you're really detoxing. You're coming off of the drugs or the alcohol. And it's a safe detox. It's all medically supervised by a fantastic physician, Dr. Gregory Jenkins.
Right, that's me.
And but at the same time, there's only so much you can intake. So technically 30 days, we're really working with them for maybe about 15 or 20 on a real hardcore therapeutical side of things. So yeah.
We're getting ready to go to a break. But
sure.
When we get back, I'd like to ask you some more questions about your center. And, the patients and the families can choose any center they want. Help us choose yours, if you could.
Sure.
So
it already sounds fantastic.
It's a gorgeous place. So anyway, you're listening to AM 1220 KHTS, and this is Dr. Gregory Jenkins with Alicia Dukov. And our phone number here is 298-5487. If you have any questions, please give us a call. Thank you.